9 a.m. and House Healthcare. Today we have in representation from Diva to talk about H35. And would somebody mind closing our door? Thank you. All right, so you guys want to introduce yourselves?
Good morning, Madam Chair. Thank you. I'm just trying to join the Zoom here really quick. So for the record, my name is Alex McCracken. I'm the Director of Communications and Legislative Affairs for the Department of Vermont Health Access. And I'm really excited to share with you all our presentation on Vermont's insurance market structure. And I'm joined today by my colleague, Addie Strumolo, who is the Deputy Commissioner.
Yep, I'll just introduce myself quickly. Addie Strumolo, Deputy Commissioner at DIVA. It's nice to see you all. Alex is going to lead the presentation, and I'm available for any questions that you may have.
Would it be useful to both of you for us to quickly go around the room and introduce ourselves, since I think this is maybe the first time y'all have been in?
I think it's the first time we've officially been before this committee this session.
Yeah. So if we just want to quickly go around the room and name and where you're from.
Oh, you have Epic Junction.
Leslie
Goldman, Wyndham 3, Bellows Falls area. Cedric Towers, Watford.
Robert McFarland, I represent Barrytown and Williamstown.
And Alyssa Black, I represent Northern Essex.
Marty Petrov from Colchester. Hi, Addie.
Page, Newport. Alan DeMar, Enosburg and Montgomery.
Daisy Burbeck, I represent Winooski.
Great, thanks.
Thank you all. It's great to be here. It's great to see a lot of familiar faces and some new ones as well. I'm going to present my slides here, if I'm able. Bear with me, the transition from Teams to Zoom is always an interesting one.
They're posted on they are posted on our committee page under today's date.
Okay, is that coming through for everybody?
No.
Okay. Okay, perfect. So as I said, today we are here to talk about Vermont's insurance marketplace structure. So today I'm going to give you a little bit of background about what that structure has looked like in the past and what we're advocating for today. Is that a little bit better? Okay. Apologize for that. So here's a little bit of background about what the marketplace looks like today in Vermont. And today specifically, we're going to be talking about the highlighted portion there at the top of that graph in the private insurance marketplace, which comprises the individual market and the small group market. The individual market is about 34,000 covered lives. 30,000 of those are through the exchange, the Vermont Health Connect marketplace. The small group market covers about 36,000 lives. Small group, for definitional purposes, is any employer that is fewer than 100 employees. So that is kind of the slice of the insurance pie that we're looking at today with this recommendation. So here's a little bit of background about how we've gotten to this point. In 2013, Vermont merged individual and small group insurance markets. This is also known as the qualified health plan market. If you hear us talk about QHPs, that's what we're referring to. That was Act 171 in 2012, which was an option under the Affordable Care Act. Why did we do this? Well, the rationale behind that was largely to increase the size of the pool. Moderate individual rates are typically smaller and less healthy market, and uniform administration and regulation, and creating the same plan options and premiums for members. In 2022, Vermont unmerged the individual and small group insurance markets. This was Act 25 of 2021, Section 34, Act 7, which was implemented in 2022. Why did we do this? Well, this was to take advantage of the enhanced federal subsidies, which only apply in the individual market. And this was done in part to reduce small group rates. And the little footnote at the bottom there specifies that federal subsidies are tied to the cost of a silver benchmark plan. Subsidies do increase when the silver premium increases, and this shields subsidized populations from premium increases. That's the intent, is to reduce the out-of-pocket costs for people in those markets. So here we have kind of a visual representation of the separation of the markets in 2022. Since separating the markets in 2022, small group premiums have continued to increase more gradually than individual market premiums, as we can see here. In 2025, the average small group premium in the Vermont QHP market is 17% lower than the average individual market premium, which is what brings us to the recommendation here today, which is to permanently separate individual and small group markets, which would result in savings to small groups. Remerging could result in about 7% or a $23.2 million rate increase for small businesses, which is pretty significant. There are more affordability mechanisms available for individual markets. So even if enhanced federal subsidies go away, which is something we're obviously concerned about heading towards the end of this year, separate markets would provide flexibility to pursue other options and draw down federal funds. We also see no clear advantage to uniform rating and plan design. Most states have separate individual and small group insurance markets, so we would be in good company there. It's also something we should note that pass-through funding is not effective in merged markets because the smaller portion of the population is subsidized, and 94% of exchange enrollees receive subsidies. So folks on these marketplace, the QHP's plans are receiving subsidies.
Sorry, but so that subsidy is based on the enhanced subsidies that we're getting right now that may end the end of this year.
That is correct.
Okay.
Yeah. So I'm sorry.
And there's no guarantee they're going to be ending. Do we know for certain?
They are scheduled to expire at the end of 2025 without action from Congress.
Leslie?
So just for clarity, the enhanced ones are going to go away perhaps, but there will still be some form of subsidy?
Yes, the enhanced subsidies that were put forward, I believe, through the pandemic are the ones that are expiring. There will still be subsidies available through the federal government, but not to the extent that we've seen in the last few years.
And that's not contingent on anything that's already in law, and we're kind of okay with that? I mean, at least it's something, or I don't know how much or anything, but.
Do you have any recollection of what the subsidy, and if you're not the right person, we can inquire, the subsidies before there was a cliff, wasn't there, where essentially they just ended at a certain income level?
Yeah.
Why don't we talk later, because we do have our healthcare advocate coming in, and I'm sure he'll.
Yeah.
I also think if Addie feels like she wants to jump in on that, she's probably better positioned than I am, but I do know it would result in a substantial hit without those subsidies.
I just didn't know what was left. That's all I'm curious about.
So the proposal, from what I'm understanding, just to clarify, if we look back at your slide before with the graph, essentially, if we merge the markets again, we would take the green line and the red line and we'd meet in the middle, probably somewhere near there. And that's what the small group increase would be. Okay.
Right. We would be increasing that rate to match the individual market. It would result in an increase for the small group market.
Okay.
So as far as next steps go, I know that H35 was introduced for you yesterday. This is our solution to permanently unmerge the market structure for Vermont, so that what we've done so far will remain in statute going forward. We do have a deadline from CMS to determine our market structure and present that to our federal partners. So that deadline is March 1st, which does present a very rapid timeline for you all. So we're here to provide any resources and information we can through this process, and happy to answer any questions. Myself and Addie are happy to answer any questions you may have at this time.
Can we talk a little bit about, and I'm not sure you or Addie, what steps could be taken? Can we go a little bit more involved on what steps could be taken if the federal subsidies go away? What other options? I mean, you did mention that there might be other options. What sorts of options that would we be looking at?
I'd yield to Addie's expertise on that, and I would also direct you, if you haven't already, there is a report available for your committee that was submitted that does talk about some of this. So I'll turn it over to Addie, though.
Yeah, this is Addie. For the record, I was going to say the same thing. We did a whole report on that topic. You all directed us to do that last year. It's a really difficult topic. I mean, the enhanced subsidies represent more than 65 million coming into the marketplace. And there's no way to completely backfill that loss. So our first, priority is advocating for the continuation. There's a big kind of groundswell at the federal level to push for that. But then I think we'd be happy to come back and walk you through everything that's in that report. There are some options to kind of partially fill the gap, but it's not, I don't want to overpromise because it's simply too big a hole to fill on the state level.
You want to give us sort of a high level?
Sure. Yep. We
Brief,
looked at a number of options. We had technical consultants working with us as well as actuaries. And so one of the things we explored was looking at changing the state subsidy, Vermont Premium Assistance. Again, comes with a big price tag, but there could be a way to kind of reconfigure that subsidy that is funded through our 1115 waiver to at least partially replace the federal subsidies that we would lose for a low income population. The thing is, you alluded to earlier, that's really tricky to solve for is that cliff that's at 400% of the federal poverty level under the ACA subsidies, the Affordable Care Act subsidies. That would be reinstated if the enhanced subsidies go away. So people who are just over 400% go to nothing. And one of the things we looked at in the study to help with that is something called reinsurance, which is a process of reimbursing health insurance issuers for high cost claims, which could moderate premiums kind of across the individual market, including over the cliff. But it would not be the same as restricting someone to only pay a certain percentage of their income for healthcare, which is what the federal subsidies do. They limit it to 8.5%. And that is, millions of dollars, especially for that population just over the 400% of FPL cliff.
Okay. Any questions? Hopper?
All we're doing with this bill, correct me if I'm wrong, is making it permanent. That's all we're doing, because we're already on.
That's correct. This is already what our market structure looks like. We're just moving it from what was done before in session law into permanent statute.
Yeah.
Wayne?
Yes, so if I understand this by unmerging, we're increasing the cost to our small group. Is that correct?
If we merged the market at this point, we would increase the cost on the small group market. By maintaining the unmerged market structure that we currently have, we'd be keeping it at the same level we are now, more or less.
So it's not going to cost businesses any more then?
That's our intention, is to not cost businesses more.
That's a good thing. And it'll help the individual market by decreasing the cost for them as well.
No.
No, it will.
No.
It's going to increase the cost.
I don't think it should have a large impact on the individual market.
But we don't know, though, do we?
Well,
Well,
because it's already the structure, there is nothing that this bill would do that would by itself increase the cost on the individual market.
Okay.
This is in effect codifying the status quo.
Lori, did you have a question?
No, Addie said it.
Okay.
So if this weren't to happen, for whatever reason, and there is the enhanced subsidies go away, how big of a pool is the small businesses? I know you gave me a number, but would they go somewhere else if is that?
Well, it would result in an increased insurance cost to those small businesses. And the number is about 36,000 covered lives in that market, which is a little bit larger than the whole individual market at 34,000. So those businesses will be looking at a significant increase to their insurance costs.
And they really don't have any other option in the state of Vermont really for buying a small business contract, the Signet or something with small businesses. I'm just wondering, like, what would be the worst case scenario if we were not to merge and their small businesses could no longer afford to cover their employees?
I think the worst case scenario would be that businesses close because they can't afford healthcare. That, from my perspective,
Because we require them to cover their employees, correct?
I don't believe we require that. We would just, either they would stop offering health insurance to their employees, which would mean that their employees would probably have to go on the individual exchange
That'll
themselves.
cost you more money.
And
which would
then-
increase the cost.
Okay,
of the
that's what I was
individual
getting at.
exchange. Yeah.
Okay. Thank you.
Can I just,
Yeah.
I do believe
Wanted to
there,
add.
correct me if I'm wrong, that there's a assessment applied to businesses who don't provide health insurance.
That's what I was thinking.
I'm honestly unsure,
Okay.
but we'd be able to easily check on that.
Okay, that'd be great if you can find that out.
Maybe we should check on that. I was gonna say, I believe there was, but I don't believe there is anymore. If you're a small business. There is still?
Yeah.
Okay.
I'll trust Mike's expertise on this.
So it's in everyone's best interest.
We would strongly recommend passage of H35 and making this a permanent market structure. So that, as for the reasons that you've talked about here.
Right. Any other questions? Oh,
Simple question. We know we have a March 1 deadline, so I'm just wondering, what we need to do to help move it along.
I think we're taking testimony on it right now because I believe it needs to move relatively quickly if we decide we're going to do this.
Yeah.
And so we
Wanna get it
obviously
out
have to
here.
go through the process of going through the Senate
You don't just take it out here.
and
About that.
And we very much appreciate your work on this, Madam Chair, and the whole committee. It's very much appreciated.
you're welcome. All right, I guess, so we don't have Department of Mental Health coming in until 9:45. So we could probably go off of YouTube. Thanks for coming in and we'll take a long break.